Hi guys, summer's over, the tans are fading, and maybe you're noticing a little more than memories left behind. Things like uneven tone, fine lines, or maybe even some new dark spots. Hi everyone, I'm Dr. Aleksandra Brown. I'm a board certified dermatologist. I want to talk to you about how to reverse that sun damage. Today, I want to give you the only video you need to watch on how to pick your over-the-counter topicals to treat your sun damage, whether that be brown spots, redness, whether it be wrinkles, or if you're somebody who's interested in procedures in the office, which ones are worth your money. And just because you have the brown spots now doesn't mean you didn't apply your sunscreen. Even if you were diligent with sunscreen, sun damage can still happen. Maybe you fell asleep outside and forgot to reapply. Maybe you didn't apply it and you were sitting inside next to a window. The list goes on and on. But the good news is that there's so many things you can do to help improve that look and health of your skin after summer. So let's get into those over-the-counter skincare options and the in-office treatments that are going to help your skin recover this fall. Let's get into it. The medical term for these changes that you're seeing is photoaging. You can also hear people say things like premature aging or sun-damaged skin, or really I just have some new brown spots. It doesn't mean just sunburn. Photoaging can show up as things like dark spots, freckles that linger and turn into age spots, uneven tone, texture, broken blood vessels, maybe even fine lines or just dullness of the skin overall. These changes gradually build up from repeated sun exposure, which is why so many people notice them more clearly once the summer glow starts to fade and the tan goes away. You start really seeing those brown spots. So let's get into what over-the-counter products can you use, what categories, and let me give you some examples in each category. Let's start with antioxidants, and I love vitamin C for the antioxidant. It's one of the best studied ingredients to repair the photoaging. It helps brighten the skin, boost collagen, protects against ongoing oxidative stress from UV exposure, and really you need to be applying your vitamin C topically on clean skin in the morning underneath your sunscreen. Let me give you a couple of recommendations in this category. Both are going to be pretty affordable. The first one is the Vichy Lift Active Vitamin C Brightening Skin Corrector. This is a more affordable option that still offers potent brightening and anti-aging benefits. It helps to even out and illuminate the complexion. It shields skin from those environmental stressors like oxidative damage, UV light. The key ingredient is the L-ascorbic pure vitamin C at 16% and carnosine, which is known for its anti-glycation properties, which means it helps protect skin proteins from further damage from sun exposure. My second recommendation here is the Prequel's Lucent C Vitamin C Serum 15%. You guys have seen me use this and recommend it over and over again. It provides that potent brightening effects and antioxidant protection at a really good price point, available at your local Target as well. Now, this is not sponsored. I just really like this vitamin C. It helps reduce dark spots. It will boost skin's natural radiance and improve overall tone. It's suitable for daily use, especially if you have normal to oily skin. If you have sensitive skin, this one's a little spicy. It can enhance skin's natural glow over time with consistent use. It's clinically proven to increase radiance and luminance after just 4 weeks, and 90% of subjects in the study agreed that their skin looked less dull. The key ingredient is 15% L-ascorbic acid or vitamin C, ferulic acid, and niacinamide. All right, you're protecting your skin in the morning. Let's get into like a nighttime category of exfoliating acids. So these are going to be your AHAs and BHAs. Exfoliating acids help fade discoloration. They smooth rough texture. They improve overall radiance after sun exposure. The AHAs like glycolic, lactic, and mandelic work on the surface of the skin to help brighten and refine the skin texture, while the BHA, like salicylic acid, penetrates deeper into clear pores and even out the skin tone. And let me give you some of my favorite recommendations in this category. Also, exfoliating acids make it into my skincare in your 40s video. So if you're somebody in your 40s and watching this, make sure you check out the skincare in your 40s video as well, because I go into how to really incorporate exfoliating acids into your skincare routine, especially if you're in your 40s. My first recommendation is the Ordinary Glycolic Acid 7% toning solution. This one's so gentle, easy to use. It prepares the skin for enhanced absorption of active ingredients in your routine. It's ideal for alternating between retinoids. You really don't want to apply your AHA and the retinoid on top. I call that the advanced technique, if you will. So if you're somebody who's very experienced with your topicals, you may want to try that route. But if you're just starting, always alternate your AHA and your retinoids on different nights and always use them at bedtime. The AHAs will help increase cell turnover, so that will help fade discoloration, even out the skin tone, and refine pores over time. Now, this one is not just for your face. You can use it for your dry feet. Apply it right after shower. shower and apply moisturizer on top. I love it, love it, love it for KP on the arms. I love it for scalp. I even love it for butt acne. You can apply this just about anywhere. You can use it under your arms to minimize the body odor or to improve hyperpigmentation under your arms. The key thing with it is to make sure you test spot. Apply a small amount on your wrist or the inside of the upper arm. Let it sit for 12 to 24 hours. Make sure you don't have any irritation before you apply it to a larger area, especially before you apply it to your underarms. The underarms are a very delicate area, and when you put your arms down, there's skin and skin contact. So that means whatever you apply under your arms is going to be even more potent. So you always want to make sure you test spot. The key ingredient in this solution is the glycolic acid at 7%. Glycolic is an alpha hydroxy acid that helps exfoliate that top layer of the skin, and it also contains a little bit of a Tasmanian pepperberry derivative, which helps reduce irritation that can be associated with the use of the glycolic acid. Another ingredient here is the ginseng root and aloe vera. These offer both visible radiance and soothing benefits to help kind of balance some of that irritation that you might experience from the glycolic itself. My next recommendation in this category is Paula's Choice Skin Perfecting 2% BHA liquid exfoliant. This one penetrates a little bit deeper to unclog pores, reduce blackheads, minimize some of the pore appearance. You can't physically shrink your pores, but you can minimize their appearance by using salicylic acids. If you use this on a regular basis, it will help minimize oil production. It will help with some of the shine you get throughout the day, and it will help with breakouts. So this one is ideal for oily skin, mature skin, but I wouldn't say that it's great for sensitive or dry skin. The key ingredient is the salicylic acid, or BHA at 2%, which penetrates into the pores to clear up the blemish-causing buildup and shed dead skin cells. Also has a little bit of green tea, which is an antioxidant that will kind of minimize some of the irritation that you may experience with the salicylic acid. We also have the methylpropanoidiol, which hydrates while visibly enhancing the skin's glow and the formula's penetration. I want to give you one more recommendation, and this one is for my advanced skincare girlies out there. So if you're just starting, do not get this one. But if you've been using exfoliating acids for a while, you should try the Prequel's multi-acid milk exfoliating AHA peel. It's a multi-acid, really milky peel. It's designed to exfoliate, brighten, and smooth the skin. It combines the clinical strength acids with like skin barrier supportive ingredients. So it's like a marriage made in heaven, if you will. This one's different because it doesn't just have one acid in it like the other two I mentioned. Rather, it's a blend of 5 AHAs. It has glycolic, lactic, mandelic, phytic, and malic acids, plus enzymes for more comprehensive exfoliation. It has this milky texture with hydrators like squalene and glycerin, which help prevent the dryness or irritation that many peels can cause. Also has that optimal pH of 3.3, which ensures acids are active but still gentle. This one's designed to exfoliate, renew skin surface, smooth fine lines, refine texture, and brighten dark spots. I would never personally use this underneath the retinoid like the other two. Sometimes, maybe, if your skin is really oily and really tolerant. This one is a night of its own. You want to apply it to clean skin, let it dry completely, and moisturizer on top. I personally find it a little spicy, if you will, and I need to have a fan for it to cool down before I apply moisturizer. Never apply close to your eyes and avoid the corners of the nose because it can be really irritating to those delicate areas. Now let's get into the category that I would assume most of you think about when you're like, how do I brighten my skin? And you're looking for brightening serums, which is really you're looking for serums with ingredients. You want to look for specifically tranexamic acid, alpha-arbutin, niacinamide, azelaic acid. Those are the ingredients that will help you brighten the skin. Now you don't want to just rely on these. You definitely want to use all the other products we talk about in this video, like your antioxidant. We'll talk about sunscreen, exfoliating acids, and retinols. But brightening serums complete the picture and help you really get the most bang for your buck out of all these products. So let me give you a few that I find to be pretty good in this category and will kind of go well with the other recommendations. My first recommendation for brightening serum is hands down La Roche-Posay Mela B3 Dark Spot Serum. It's perfect for that dull skin, for dark spots, discoloration. It has this really unique ingredient called melasil, and it's combined with 10% niacinamide, which can be irritating to super sensitive skin, so be careful with it. And this combination gives it ability to help fade persistent dark spots while also preserving the natural tone of all skin tones. The key ingredients in it are the niacinamide, melasil, and La Roche-Posay Thermal Spring Water. My next recommendation here is the Allies of Skin tranexamic acid with arbutin advanced brightening serum. Rather than relying on a singular here ingredient, this sensitive skin friendly serum takes a multi-brightener strategy. It combines the tranexamic acid, arbutin, niacinamide, and antioxidants all in this one perfectly thoughtfully layered, effective yet gentle bottle. It's ideal for someone seeking a daily brightening product that's going to be elegant, cosmetically really appealing, and sensitive skin friendly. The key ingredients here are the niacinamide, the reishi mushroom, and and tranexamic acid. So if you're somebody with sensitive skin, you may want to start with this one. My next recommendation is going to be a little more budget friendly, actually quite a bit budget friendlier, and that is the Ordinary Alpha Arbutin 2% plus HA. This is a very affordable, effective choice to reduce your dark spots with hydration from hyaluronic acid at the same time. It will help fade dark spots and acne marks, and as well as post-inflammatory hyperpigmentation, melasma, or any sunspots that you may have. It evens out skin tone by reducing patchiness or dullness. It's safe for daily use. It's gentler than some of the other options. It's definitely gentler than a prescription hydroquinone. So this one's also suitable for sensitive or darker skin tones. It's also very compatible with other brightening actives like niacinamide, vitamin C, or azelaic acid if you were to layer them together. Speaking of azelaic acid, the Ordinary Azelaic Acid Suspension 10% is my next recommendation. And the reason this works is because azelaic acid inhibits tyrosinase, which is the key enzyme that produces melanin, helping to reduce that existing pigmentation and prevent new spots. Azelaic acid also promotes healthy cell turnover, and it will help calm inflammation that's often worse with pigmentation. So it's not only working on your browns, it's helping with some of the redness as well. Let's get into the next category, and that is the sunscreen. And I'm here to tell you that this is literally the most important ingredient in all of aging and pigmentation and healthy skin, period. Sunscreen is the single most important product for protecting your skin against photoaging. But also, if it's already happened, it is never too late. There's many studies out there with patients in their 50s just starting to use sunscreen and seeing great results. Daily use of sunscreen prevents further sun damage and maintains the results of your repairing products. So sunscreen is going to be your best return on investment and easiest thing to do that will protect your skin and give you healthy skin while also making sure that your other products are working and you're not seeing any further damage. I personally prefer tinted formulas, and that's because they have iron oxides, which helps block visible light that can contribute to pigmentation. I'm going to give you 2 recommendations in the tinted sunscreen category, but if you're somebody who doesn't like either of these and you want to look at more, make sure you check out my other SPF review series. I have reviewed multiple sunscreens. I even have a long form SPF tinted video. I'm going to go ahead and link that down here below, where I've reviewed several tinted sunscreens if these 2 are not your jam. My first recommendation here is going to be Bliss Blockstar Daily Mineral SPF 30. This is tinted 100% mineral daily sunscreen. Features this vanishing tint, blends into skin perfectly. I love it. It doesn't feel greasy at all. Feels very smooth, almost like a mousse. I love that it's tinted, and I love that it's 100% mineral. It protects against UV damage while helping to block even that visible light that contributes to melasma and hyperpigmentation. I find that it blends really easily and provides really natural looking tone on my skin, and I'm like a skin type 3, very olivey. The key ingredients are your mineral sunscreens like zinc oxide and titanium dioxide. Also has iron oxides for that tint, as well as antioxidant blend. My next recommendation is Dermatologist True and Tried Elta MD UV Clear Broad Spectrum SPF 46. This is super lightweight daily sunscreen. It's great for that oily, acne prone, or sensitive skin. It's tinted, so it's going to protect you against that visible light that's going to worsen your hyperpigmentation, but also contains soothing ingredients to calm any redness or irritation if you have sensitive skin. It's totally non-comedogenic and super easy to wear underneath your makeup. The key ingredients are the zinc oxide, iron oxides, and niacinamide. Now let's get back into the night skincare routine. I'm going back and forth a little bit here, but let's talk about retinoids, because if you have ever watched my skincare in your 30s video, and if you haven't, I'm going to link it below. I talk about the 3 non-negotiables, which is your vitamin C, your sunscreen, and your retinoid. You really need to be using retinoid once you hit your 30s, but you need to be using vitamin C and sunscreen in the morning as well. So check out that video for sure. Retinoids are your gold standard for photoaging repair. They also help with acne, so if you're somebody who has acne and you're in your 30s or 40s and you're looking for a tretinoid prescription, your insurance may even cover it. Retinoids work by increasing collagen production to improve skin texture, and when they are increasing that cell turnover, also they're going to help with pigmentation over time. I'm going to give you a couple of over-the-counter recommendations. My 2 favorites are going to be Rock Retinol and CeraVe Resurfacing Retinol Serum. They're both going to be very affordable, very gentle, accessible. You can find it at your local Target or Walmart. Retinoids work by improving the uneven tone and texture from sun exposure. They're going to help reduce the look of post-inflammatory marks and hyperpigmentation, and they're both gentle enough for the beginners. Now, if you're somebody who's a beginner and you have extremely sensitive skin, I always say only use a pea-size amount to cover your entire face, avoiding your eyes and the corners of your nose, and make sure you moisturize on top. Also, only start like 3 to 4 nights a week and increase if your skin can tolerate it. If you're somebody who has been using over-the-counter retinoids every single night and you've experienced 0 irritation, it might be time to up it to prescription tretinoid. Tretinoid is a prescription medication that's clinically proven to reduce fine lines, wrinkles, and uneven pigmentation. It comes in 3 different strengths. You have 0.025, 0.05, and 0.1. 1. Stronger is not better. Stronger will be more irritating. I always recommend starting 0.025. If you want to go up to 0.05, I would only recommend doing that if you're truly using your 0.025 every single night and you have zero irritation whatsoever. Most clinical studies are done on tretinoin 0.05, but that is not to say that that is the strength you need to get the same benefit. You always want to listen to your skin, because if you have sensitive skin, using higher strength tretinoin is not going to help you at all. You're just going to create more inflammation, redness, possibly even hyperpigmentation. Tretinoin works by accelerating cell turnover to smooth the texture. It is most effective option for reversing signs of sun damage. The results are better the longer you use it. It takes at least 2 to 3 months to see significant improvement from it. Now that I've given you all that information, I talk fast, I'm aware of that, but let me slow down for a moment and give you like a summary or some pro tips as somebody who suffers with rosacea, melasma, hyperpigmentation. My skin is sensitive, so I'm using all these things and I tend to alternate them. You always want to pair your brightening serums, especially those with like vitamin C or acids or anything you're using that has actives in it, with a sunscreen in the morning. Most of your actives like AHAs, BHAs, retinoids are going to go on in the evening. Your vitamin C always goes on in the morning with your sunscreen on top. And then you're going to take your brightening serums and add them twice daily. In the morning, I like them on top of vitamin C. In the evening, you want those brightening serums underneath your skin first. Always pair brightening serums, especially those with vitamin C, or if you're using any exfoliating acids, with daily SPF to protect your skin to enhance those results. You always want to introduce new active ingredients gradually. So pick a couple of nights a week. Just use your new active ingredient, whether it be alpha hydroxy acid or something with niacinamide. Make sure your skin is not irritated at all. Make sure it doesn't burn or sting. And if you're not having issues with it, go ahead and up it to every single night. Brightening effects can take 3 to 6 months of consistent use. So patience and consistency are going to be the key. Now that I've given you all that information, let me give you almost like a breakdown of a AM and a PM routine. What would that look like? So in the morning, washing your face is optional. You can just use a washcloth and water. Go ahead and apply your vitamin C to clean skin. After vitamin C, if you have a brightening serum that you like, you can apply that now. After that, you need to apply sunscreen. Most sunscreens already have a moisturizer in them. If not, you can go ahead and apply moisturizer and then sunscreen. Okay? Your nighttime skincare routine, you want to wash. You definitely want to cleanse your skin in the evening. Maybe even consider double cleansing if you wear heavy makeup or lots of sunscreen. After cleansing, you want to apply your brightening serums first if you have any of those. Let your skin dry completely, then apply your retinol or your tretinoin. Let it dry completely, and then follow with a moisturizer. Give it 3 to 6 months. If you're not seeing results, see your dermatologist and talk about if there's any other in-office treatments that are going to be appropriate for you, or maybe you need a prescription for tretinoin. So let's get into those in-office treatments. Those professional treatments can deliver more of a dramatic result for photoaging, especially when paired with the right skincare routine, which is why it's so important to have your skincare routine down already, because even if you go in and you get a treatment, a miraculous one single treatment that removes all your brown spots, guess what? They're going to come back if you don't have good skincare routine. So having the routine and having that discipline and making sure it's on the budget and doable, like you have time and money to do all this, is so important before you go spend money on further procedures. So what are some options that we can do in the office? The first one is chemical peels. These are medical grade strength acids. They're going to gently remove the damaged outer layer of the skin. I say, think of it this way. If your tretinoin is driving 25 miles an hour down the highway, your chemical peels are going 100 miles an hour. Tretinoin and chemical peels accomplish very similar things. You just do it a lot faster when you're doing a chemical peel. That's not to say they take place of each other. Your tretinoin should be maintenance and is best if paired with a chemical peel, not in place of it. Chemical peels do a really good job at fading dark spots, at brightening dull tone, and smoothing rough texture. The downtime really depends on the strength. It can be a few days of like light flaking, or it can be like 3-4 weeks of your face is red and you don't want to leave your house. Now keep in mind, things that have less downtime are going to be less expensive and have less impressive results. Things that have more downtime are going to be more expensive and have more impressive results. So you're not going to get a no downtime chemical peel that doesn't cost you much money and have fantastic results. That just doesn't exist. If it sounds too good to be true, it is too good to be true. Don't fall for it. Let's get into lasers. Fractional resurfacing lasers like Fraxel can help improve fine lines, wrinkles, and help with pigmentation and texture by stimulating the collagen. It's a nice laser that combines all in one. But if you're somebody who has melasma, you really want to make sure you have an experienced provider, because putting too much heat on melasma can and will trigger melasma, and you are going backwards now. If you're somebody who has vascular issues, like you have broken capillaries or redness, vascular lasers are one of my favorites, especially the pulse dye laser. They help minimize the redness and broken blood vessels from all that chronic sun exposure. You typically want to expect a little bit of redness, swelling, maybe even bruising with a heavier setting. I personally tend to be a little heavy-handed the mid-pole style laser, but results are fantastic. Keep in mind, it's not one and done. You're going to need multiple treatments when treating those broken capillaries. The next in-office treatment is the IPL, or Intense Pulse Light. This one's really great if you're somebody who has light skin with dark spots. It does fantastic. This is not a true laser. It uses broad spectrum light to target both brown spots and redness at the same time. So it works really well for freckles, sunspots, uneven tone, even like blotchiness. IPL tends to have that minimal downtime. Most people will have a few days of redness and brown spots look a little bit darker, and then they just kind of flake off over the course of 7 to 10 days. But if you're somebody who has melasma, do not do IPL. It produces so much heat, and odds of your melasma getting worse are so high, it is just not worth it. Make sure you have an experienced person doing your treatment, and maybe even consider pre-treating with hydroquinone. Microneedling and radiofrequency microneedling, these are great procedures because they create these controlled micro injuries to trigger new collagen production. Microneedling is one of my favorite treatments. Radiofrequency microneedling is okay. There's a little bit more pain, maybe slightly more results, and it tends to be more expensive, so I personally tend to opt for microneedling over radiofrequency microneedling. The standard microneedling has very little downtime, maybe like a day or two, while radiofrequency microneedling is going to have more like a week or two of downtime. All right, guys, that's all I've got for you today. That was a lot. I feel like I'm losing my voice here. I hope this was helpful. I hope you find some of these products very beneficial. Hopefully, just doing the over-the-counter treatments gets the job done and you don't need any in-office treatments. But if you do, make sure you see your dermatologist and discuss what is the proper treatment for you. Make sure you know the difference between sunspots and melasma and know which laser does what. Now, let me know in the comments, are you going to stick with at-home products, or are you somebody who prefers in-office treatments? Or do you like a healthy mix of both? You can also find me on Instagram and TikTok at Dr. Aleksandra Brown. Thank you so much for watching. I'll see you next time.